Unfortunately, our beloved pets can take a turn for the worse. We may need to perform CPR or cardiopulmonary resuscitation. One of the first things that we do is to check. We will try to shake them, and if we don't see that they're moving, then we will immediately cry for help so that technicians and doctors can come to that pet's assistance. We will check a patient's airway, so we'll open their mouth and make sure there isn't any obstruction. And then usually very quickly we will use what's called an endotracheal tube, and we will place that into their airway. This will stay in place while a patient is receiving CPR so that we can give them breaths. We'll sometimes use an anesthesia machine, or we might use an ambu bag, which is something that you might see used in human medicine as well. All of this happens very quickly, and as soon as these additional people come to this pet's aid, we will begin additional aspects of CPR, which typically include chest compressions. This machine here allows us to connect an ECG, which shows us the heart rate, and then also a pulse oximeter, which shows a patient's oxygenation levels. Usually at least 2, if not 3 or 4 people are performing CPR all at once, so that we can get the airway controlled, we can begin chest compressions, we can get the monitoring on, and sometimes we also give patients drugs to try to get their heart and breathing in a better situation. What we're trying to do is get blood pumping by putting our pressure directly where the pet's heart is. This is usually with a patient on their side, unless they're a barrel-chested breed like a bulldog. Those patients will have CPR performed on their back. We're usually positioned directly over the pet with our elbows locked to get the best pressure into their chest, and we're trying to perform chest compressions as quickly as a normal heartbeat. With the pressure directly on the heart, we can then push blood throughout the patient's body while we work to breathe for them and give them medications to try to get patients feeling better. The first round of CPR is about 2 minutes, and then we check patients to see if they've recovered. So we'll feel for their pulses, and we'll check to see if they've regained any consciousness or have started breathing. One of the most important things is to never stop. So we actually usually rotate who's doing chest compressions on a dog about every 2 minutes. Unfortunately, because CPR requires non-stop pressure on the chest, it is a very difficult thing to perform at home and to get good results. So though you can definitely check a patient's airway and give some chest compressions at home, I would say most of the time your best approach for a pet who has collapsed or has taken a turn at home is to get them in a car and get them to an emergency room, like one of the emergency rooms we have at MedVet.